Amish, you and I are on the same tone here. You as the pro and me as the clueless, and that is the India Delta variant seems to not be systemic, but seems to be very narrow. And the narrowest can be in America, the Southwest, or maybe a Los Angeles, it's worse. Or maybe it can be what I see in the statistics, the quote, rest of Asia really struggling as well. Tell us about the specificity of the map and a variant.
So you have to remember that this variant is more contagious, and our vaccines are highly effective against the variant, and prior immunity is going to have some impact on the variant. So what you're going to see when you look at a map is that proportions of the population of the world that have low vaccination rates, that's where Delta is going to flare. And the flares are going to be very different because in places where even if the high-risk people are vaccinated, you will see cases, but they won't necessarily run into hospitalizations. And that's what you're seeing in the United Kingdom. But in places where you have no vaccines and little prior immunity and the Delta variant, that's a recipe for hospitals getting into problems again. And we're not going to see that much in the United States, but there are places like Springfield, Missouri, where they've gotten into trouble because there's enough high-risk people that aren't vaccinated. But I do think when you look at the world and the lagging rollout and the lack of vaccination in many parts of the globe, the Delta variant is going to have an easy time running through those areas. And the goal in those places is to get their high-risk population vaccinated as quickly as possible.
Is there a history here? And I think of rubella, the great measles debate, which is ancient history for young people like Romaine Bostick and Matt Miller. But Dr. Adalja, do we have a risk here of percent vaccinated giving us two Americas?
I definitely think that's already happening. But in many times when we talk about percent vaccination or vaccination differences, it's because of lack of access to vaccine. But that's not the case in the United States. Everybody can get a vaccine who really wants to. It's very convenient to do it. But I do think we're seeing this separation, and there are certain places, Arkansas, Missouri, Nevada, Mississippi, Alabama, where vaccination rates are really, really suboptimal. And COVID-19 is going to still continue to be a disruptive force in those states, while it's not going to be one in Pennsylvania or New York or New Jersey because of the way the vaccination rollout has went and the acceptance of the vaccine by the population. So this is the next challenge, is trying to bring those areas up. So the Delta variant is even less of a problem there than it is going to be for the rest of the country.
Yeah, some of these regional differences are absolutely stunning. I mean, the numbers out of Springfield with regards to the hospitalizations definitely cause for concern. I am curious about some of the cross-border issues, Dr. Adalja. There was a lot of talk over the last couple of weeks about why the U.S.-Canadian border continues to be shut down for any sort of recreational crossings here. A lot of folks still sort of scratching their head as to when you have states that sort of abut that border that are basically around 60, 70% vaccination rates, why they cannot travel freely.
Yeah, this is something that doesn't really make sense to me. I think that we have now, in this era of the pandemic, with high levels of vaccination in individuals, ways to test people rapidly. There's no real reason for that border to be closed. There's many borders that are open. Americans can go to many other countries, but they can't go to Canada. And I think that makes zero sense, because in some cities, there is really a border that's just a different street that you're on, and you're in Canada. So I think this is something where we need some rationality in the policy. And I think it's something that can be opened safely without harm to either country. And I think that it would be a good sign to show that highly vaccinated countries can go back to normal, and Canada is now more of a highly vaccinated country, and we have testing and protocols to make that safe, just like when an American goes to Mexico or an American goes to any other country that's open.
I can't imagine why anyone who's fully vaccinated wouldn't be able to fly into the U.S. My wife is going to have a problem with it next week because she's Spanish. Fortunately, she's carrying a fully American infant with her. But my concern, and maybe it's because I read too much fiction, Amish, is that we have the under-vaccinated countries creating new variants every day. The Delta variant certainly isn't the end of this. As Niall Ferguson said, the problem could be the Omega variant. Is that how these things typically go? Do they get worse, or does the case fatality ratio get better as they go on?
It's a complicated type of calculation because it's not always one way or not always linear. But yes, there's going to be more variants. And we talk about Delta, but there's a Lambda variant in South America. There are other variants that are going to continue to arise because viruses just evolve. But what we know so far is that our vaccines are highly effective against these variants, especially when it comes to what matters, preventing serious disease, hospitalization, and death. COVID-19 is not going to go magically back into bats. We're going to be dealing with it. And I think we have to come up with a sustainable approach by vaccinating high-risk individuals, protecting hospital capacity. But then I think we've got to sort of move on with our life using testing, tracing, isolating, trying to keep it away from vulnerable populations. And I think that's what we're going to be facing. Variants are going to come and go. Some of them might be more contagious. Some of them might have more severity. But it's not necessarily the case that there's going to be some kind of Andromeda variant that arises that's able to evade everything that a vaccine can do. It's very hard for a virus to be able to mutate away from everything that a vaccine protects you against, especially those three things: serious disease, hospitalization, and death. So I think it's a theoretical concern, but I don't think it's a real one. And I think we've got great vaccines.